This is Chris Kelly with LakelandLocal.com with just a simple test and a few corrective tips for knee pain. Now, when dealing with knee pain, we have a variety of injuries, from ACL tears to meniscus injuries to PCL tears. Oftentimes, we don't know the specific cause of pain. We just know that full flexion of the knee, using the knee what we call as a hinge, really full range squats, full range lunges, are going to provoke pain. With that said, what we want to do in order to correct that is make every move a hip dominant movement. Oftentimes when we're dealing with knee pain, we see people hinge from the knees when they're squatting down. So, when I see somebody squatting with knee pain, oftentimes I'll see this. Okay, they're squatting, they're coming forward onto their toes, and their knees are hinging way in front of their feet here. What that means is that their knees are acting as the primary focus of the movement, all right? So that joint is bearing all of that weight, and it's getting all of that compression. And, if you think about doing that several dozen or more than that times a day, you can see how that area would kind of become, frayed and injured. With that said, what we can do to correct that is simply stand over a box, instruct the person to spread their legs wider, sit back, push back with the hips first, and sit back down. Okay, what that's allowing me to do, it's keeping my knees over the toe. I hinge for my hips because I want to sit down as opposed to using my knees to do so. And that is what is called a hip dominant movement. Really the ultimate exercise for a hip dominant movement would be a deadlift. All right, so bending over to pick something up off the floor, immediately I have to use my hips there. So that would be my #1 exercise for somebody with knee pain. Just a double leg deadlift. You can use a bag, you can use things like dumbbells, kettlebells, whatever you can pick up off the floor, but that movement can give you a lot of mileage right there. With that said, when we're trying to kind of reincorporate squats and lunges and different exercises that involve maybe a little bit more knee flexion, we just want to make everything more of a hip dominant movement. In order to do so, one technique that I like to utilize is starting from a dead stop. All right, when I say a dead stop, I'm going to start from the bottom here. What this allows me to do is immediately look at my movement to see if I'm starting over my toe, and if I am, I'm just going to pull myself back, correct it, make sure I have some breathing room here between my toe and the front of my foot there, and shoot straight up. I'm coming back down, adjust myself back if necessary, and that's a great way to go with that. By the same token, we could do the same thing with a step up by simply stepping down every time, kind of watching this, kind of sitting back a little bit more on the heel, and stepping together. With the squat, that would simply be done by placing a box or something you can sit back onto, hinging from the butt first, kind of coming down. You don't have to sit down, but just kind of tap it and come back up. While I wouldn't recommend super loading with any of these exercises, beginning from a dead stop is going to make it more difficult, so we can get away with using lighter weight, but by the same token, we're maintaining kind of that vertical orientation. We're using our hips as the driver of the movement, and we're kind of foregoing that knee pain that might result from full flexion. So those are my tips for knee pain, and check out our next tip on shoulder issues.